Can chronic pain be inherited? Really is an interesting question. Because if chronic pain can be inherited, it expands what we need to take a look at as physical therapists and expands how we need to start to interact with our patients. Because in this case, if chronic pain really is inherited, then the pain our patients are experiencing is really not a reflection so much on what's going on with them, but things that they've experienced and their families have experienced way in the past. And so I got to tell you that our research team is just so excited about this line of research that we're starting to head down and what we're starting to pursue and what we're starting to take a look at. And the more research we look at, the more articles we see on the topic, the more excited we even get with this topic of chronic pain and inheritance. But let me start by saying that we are still at the beginnings of this journey, and that myself and my research team, none of us are geneticists. We are people who look at human behavior and see if there's a correlation between our behavior and our behavioral responses, where pain is a behavioral response, and families and lineages. So that's the framework which we're going to be looking at this question of, can chronic pain be inherited? Now really, this is not our first dive into this topic of chronic pain and its association to inheritance. About 3 or 4 years ago, myself and Kim Dunleavy and Louis Pontedura and Neil Spielholtz and Sam Cheng, we all started to take a look at exploring the literature to see if there was a correlation between chronic pain and post-traumatic stress disorder. And I have to be honest, part of that was because of the research we were doing and looking at our research topic. And our research topic is that pain is really a memory. Pain is a function of memory and learning. And so if we start to take a look at it from this perspective, then there's really not a lot of literature that looks at chronic pain and learning. Now, that being said, it's growing leaps and bounds. Tori Madden and Daniel Harvey and their groups are starting to look at that, the way we start to learn and start to develop memories for chronic pain, as well as groups in Europe as well. But about 3-4 years ago, we summarized literature at that time, and we formed a narrative review. And what our goal was to say, is there a relationship between chronic pain and post-traumatic stress disorder? The literature at that time, and even now, even more so, the literature is suggesting that there is a fairly strong link and correlation between chronic pain and post-traumatic stress disorder. Now, that's not to say that all people with chronic pain have post-traumatic stress disorder, and all people with post-traumatic stress disorder have chronic pain. But there is enough of an overlap to suggest that they're close cousins. And so that really helps us as we start to take a look at different topics, because in a lot of the research that we do, there's not a lot of literature on pain chronicity, but there is quite a bit of literature on post-traumatic stress disorder. So if we can start to use some of that literature and borrow from some of that literature to help inform the research decisions we make, that's a good starting ground until we get our feet wet. So what does most of the literature say about post-traumatic stress disorders and inheritance? Well, let's start with trauma research in general at the beginning. It is very, very difficult to do large-scale trauma PTSD studies. IRBs just will not afford you the opportunity to cause enough trauma to someone to result in post-traumatic stress disorder in a large scale of people. So if that's the case, then really what we need to do is start to take from natural events or man-made events that caused huge traumatic shifts in the population. And so even though 9/11 was terrible, and it's the 20 years since that event occurred, it did offer opportunities for research to take a look at things like PTSD. And one of the biggest researchers is actually in New York. It's Rachel Yehuda and her group. And they're studying PTSD, and they're looking at PTSD and whether it can be transferred from parent to child. And so interesting, their studies, and you can see some of those listed below, they have a common thread to a lot of their studies. What they'll do is they'll take, in this case, with 9/11, they took women who were pregnant during 9/11. And what they did is they studied their response to stimulus. And in people with PTSD, they had a heightened stress response to stimulus, a heightened startle response to stimulus, as opposed to the group of patients who are subjects who were exposed to 9/11 as well, and they did not have PTSD. So that was your control group. And in that control group, there was less of a startle response and less of a stress response. And that's an interesting study to look at from the person's perspective. But the interesting thing, remember I said it were people who were pregnant as well. And what they found is that the children who were born of mothers who had PTSD, their startle response, their stress responses were increased as well. Okay? As opposed to the control group that did not have PTSD, their stress responses, their startle responses were near normal. So from this literature, Yehuda and her group is starting to build this thread of thought that traumas that are experienced by parents can potentially be transmitted from parent to child further down the lineage. Now, a discerning and a smart reviewer of literature will say, well, is that really evidence that something was transmitted across a generation, or is that more evidence that the fetus actually was able to learn and hear and experience sensations while they were in the womb? And that's a great question. And so we can't rule that out at this point with this particular line of research. We're 20 years out, and the children of 9/11 are starting to get to an age where they're having their own children. So within the next 10, 15 years, I'm really looking forward to see the second generation, whether they have heightened stress responses as well. There are certain populations that we have enough time that has passed by where we can actually see how these responses are shifted and changed from generation to generation in 1, 2, 3, 4 generations. Well, probably not 4 generations, but at least 3 generations down the road. And that's at Holocaust studies. And so Yehuda's group is also taking a look at Holocaust survivors. And they're finding that PTSD is related to PTSD and heightened startle and stress responses in their offsprings and in their offspring's offsprings. Now, this is one line of research that they looked at. Yehuda looked at the first article there is looking at maternal factors, and they're suggesting that it's the maternal lineage that is transmitting this transgenerational information. But if you look at other lines of literature, it's suggesting that PTSD and trauma potentially can be passed on through the father as well. So you heard me talk about this term transgenerational inheritance. Really, this passing on of an encoding of information in one generation and passing it to their offspring and their offspring's offspring is really termed transgenerational inheritance. It's inheritance that goes across various generations. Now, the concept of programming and genetics and inheritance really dates as far back as the work of Darwin. You studied this in your elementary schools, and you studied this in your junior highs and high schools. The Darwinian concept of inheritance really involved the DNA itself. What we're looking at now and what's caused this huge uptick in interest in DNA and genetics is the fact that we now know that material and information is actually encoded on top of the DNA strands as well. This coding and encoding that occurs on top of the DNA is what we call epigenetics, or on top of the genetic coding. And really, this guy had to start at the works of Waddington in 1942. And so with this big interest now in epigenetics, we're now finding that we can take DNA and we can see how it's coded. And you can take that epigenetic coding and see if that coding is transmitted from generation to generation. So far, we know that the transgenerational inheritance occurs in a number of cases. We know that in famine studies, there's obesity that commonly occurs after famine. And because one of the rationales that they're thinking this occurs is because after famine and starvation, the body learns to store fat for use in the future and for survival. This programming of the adipose tissue has been changed at an epigenetic level. And so when someone eats food, it stores the adipose tissue and holds onto it, and it's very difficult for it to be gotten rid of. And so this type of presentation and this type of encoding, we know carries on from generation to generation to generation. We also know there's a significant amount of research that's taking a look at environmental toxins and exposure to toxins within our environment, such as smoke or BPA. And the BPA is a chemical released during like the formation of plastics and things like that. And so we know that these environmental toxins can damage the epigenetic coding, and this damage can go from one generation to the next generation to the next generation. And we also know that there's a growing amount of literature that suggests that both physical and emotional stressors, they code the epigenetic structures of the DNA, and that could be transmitted from generation to generation to generation. So now we have this thread of thoughts where we have, chronic stress or PTSD, traumatic stress, can be passed on transgenerationally from generation to generation. We also know that chronic pain is closely tied to stress. So now the question is, if we jump forward, is chronic pain something that can also be transmitted across generations, just like PTSD? There's an increasing evidence, and we're just at the beginning. If you do a literature search now, you're going to see a few studies that look at this concept. Can chronic pain be passed from generation to generation? If I had done this line of search 5 years ago, there would be nothing for the most part. Now they're starting to get into whether it can be passed on from generation to generation, and you'll see some of the references there below. So this informs our current line of research that we're really, really excited about. Our research questions are, in individuals with chronic pain, is there a common pattern or complaint of symptoms across generations of patients? And in individuals with chronic pain, is there a history of trauma that may have precipitated the pain that may be transferred from generation to generation? So our hypothesis is in that individual with chronic pain, there's a common pattern of pain experienced between family members, and that this pattern can be traced back to some type of trauma experienced sometime in the lineage. Our study's taking a look at population. We're taking families of an individual who has chronic pain, chronic musculoskeletal related pain, and we're comparing it to families of individuals who do not have history of chronic pain. And what we're doing is simple looking at surveys, responses, and self-reported evidence. So we're looking at self-reported surveys and questionnaires. And then from this, we're going to hopefully find groupings or subgroupings of patients in which there seems to be a family pattern that occurs. In those groupings of families that we find that there seems to be a pattern that comes along, we're going to then do focus groups, and we're going to do qualitative interviews to start to break down and say, okay, what is the commonality that occurs? One of the questionnaires we're going to be taking a look at is the Adverse Clinical Experience Study for Chronic Pain. And this is a 10-question self-reported questionnaire. It picks up things like physical neglect, emotional abuse, physical abuse, and domestic violence. And we're going to correlate this with chronic pain and correlation between generations of families. If you look at the right, those are just some examples of the ACE study, and it's been used for quite a number of studies. It's pretty a well-established study for looking at trauma that is generated earlier in life. So other tools that we're going to be taking a look at to make comparisons about information, we're going to get the general demographic information, and we're going to look at areas of symptom to see if there's commonality that occurs across generations. We're going to look at mechanisms of injury and see if there's common mechanisms that exist. We're going to look at certain self-reported questionnaires as well. The Patient Health Questionnaire 9 and the Depression, Anxiety, Stress Scale and the Fear of Pain Scale. These are all mental health questionnaires that have good psychometric measures or values. And we're going to look at some physical health questionnaires as well. The General Health Questionnaire 12 and the Short Form Health Survey 36. To get an idea of how they're functioning from a physical standpoint. This study is currently making its way through the IRB process, and so hopefully we hope to start to collect data in this upcoming year. This is just the tip of the iceberg. Our research group is hopefully going to look at other more quantifiable measures that can see if that's transmitted from generation to generation as well. Things like pain threshold studies, quantitative sensory testing studies, and tests that test heart rate variability or cardiovagal responses. So these are all exciting lines of research that we can see are these responses purely something that's occurring from a behavioral perspective, or are there also physiological responses, common physiological responses that we can find that cross from generation to generation. So what are the clinical implications? I'm still a clinician, and I'm really excited about this. And I've been seeing it for years, over the past 20 years. You start to see patient to patients come in, and you start to see common patterns. Pain is potentially a learned response that can be encoded into our DNA and passed from generation to generation. As a clinician, our role is often seen as someone who helps alleviate a person's pain. But it's really interesting that if you think of it more globally, in the people who have chronic pain, if you can break that cycle, then you could potentially impact generations to come in the future. Or conversely, if you let that cycle get out of whack or get out of control, that could influence potentially generations from one generation to the next and be passed on. So it does put a lot of stress. It puts a lot of weight on our profession, because our profession is trying to be the people who help manage and prevent chronic pain. You can see what a large global potentially responsibility we have if we start to find that these genetic markers are actually passed on and that we can make a change. The interesting thing, and I'll just leave you with one thought as we're finishing up, is that the PTSD literature really is suggesting that we have like a 30-day window before this information is encoded long term. So encoded onto our DNA epigenetically. So if we can make changes in our patients' perception of things, if we can change their encoding responses in those first 30 days, then we can potentially keep it from going chronic and keep it from affecting generation to generation to generation. So our goals in that first 30 days should be really to change the clinical picture. Reduce the need to encode it in our brain for long-term storage, which means reducing the fear, the emotions, and the threat associated with an injury. And then progressing that forward. If we can reduce that, we can potentially stop that process, and potentially, if the literature suggests out, if our findings suggest out, then prevent it from affecting generations to come. And thanks. We loved the talk, and we thank you for the opportunity to speak to you.